problems, especially from HIV/AIDS, and they've enlisted the help of places here in the U.S. To help them. And I'm an alumnus of the University of Pennsylvania, and the medical school at the University of Pennsylvania is providing a lot of benefit in helping the people in Botswana struggle. And as a cardiologist, I had a lot of work to do. I'll explain it to you. I'll explain it to you. I don't know, can you see the bottom screen here? Just to give you an idea of where Botswana is. It's in southern Africa. This is the continent of Africa, and the blow-up is just this little square. And, less than 2 million. There are less people in Botswana than there are in Manhattan. The reason is most of Botswana is Kalahari Desert. And the desert involves most of the country. There's just a thin rim of fertile area along the border that is of South Africa. This is all South Africa, just to, you know where that is. Unfortunately, right next to Botswana is Zimbabwe. That's been in the news lately. The desert is semi-desert. That is, it's not just sand. There are things that grow, and especially in the rainy season. I was lucky enough to be there at the very end of the rainy season, so things were more or less in bloom. And this is the flag of Botswana. This is not just a mock-up. There was actually a flag on a pole and enough breeze so I could take this picture. The important thing on this picture is this blue area. And the blue area stands for water. As you can imagine, in an arid area, if the rainy season fails, it's terrible, because farming, and especially cattle, are very important for the economy of the country. So when people toast in Botswana, they hold their beer or whatever in their hand and say "pula pula pula," because pula is rain, and they toast to having more rain. Although the other thing, I just noticed it looking over my stuff. I didn't make a slide out of it. Maybe you can see it in the close row. This is a 10 pula note, so the name of their money is also pula. So maybe when they're toasting, they're really just hoping that the stock market will go up. But the other important thing in this flag is the black stripe and the two smaller white stripes. There's zero problem, to a large extent because Botswana was never colonized. It was a protectorate of the United Kingdom, that is Britain, and the people in Botswana invited the British in to protect them against the Boers during the Boer War, over 100 years ago. The British finally left in 1976, or a little over 30 years ago. A year after the British left, diamonds were discovered. So believe it or not, over 40% of all diamonds in the world come from Botswana. So they're not bad off. And this is where I stayed. I stayed obviously in an upscale neighborhood. This is the house that's owned by the University of Pennsylvania, where the faculty of the University of Pennsylvania hang out. There are also students from medical school, from the medical school of the University of Pennsylvania, that come to Botswana to do a clinical rotation. Now, all I said, everything sounded great. The big problem, as I alluded to before, is the fact that HIV/AIDS is killing people left and right. The population has actually declined in the last 10 years. 10 years ago it was greater than Manhattan, now it's less than Manhattan. And the government, with the aid of people in the United States, is fighting very hard to end this epidemic. And there are signs like this all over the place. Join hands with us to fight HIV/AIDS, empowering the workplace to fight HIV/AIDS. This may be a little hard to see, it's a very busy slide, but the country is divided in districts, and the increase in AIDS from 2003 to 2005 is, even though it's a busy slide, you can gather that just by looking at this quickly. Now, each bar is a different age group, and it turns out, very worried about HIV/AIDS, it's less than 1% versus 40%. In their effort to stamp out the disease, and the disease in Botswana is a little different than it is in this country. There are virtually no IV drug abusers. Well, in this country, a lot of HIV is from IV drug use. There's virtually no homosexuality. The disease is a heterosexual disease and is preventable. You prevent HIV simply. You don't do it, or you use a condom. And condom dispensers are also all over the place. You walk down the road and there's a tree and you see a condom dispenser like this. The condoms are free condoms, free. So it drives the point home. The responsibility starts with you. And we know that. It's 100% preventable. I looked at this sign, and these are billboards that are also commonplace. And it says, people say that small houses strengthen relationships for those reasons. So what do? You treat patients. And if you can't prevent it, you treat the patients. And this Princess Marina Hospital is the main government hospital in the whole country. And it's a pretty big hospital, even by New York standards. This is where I hung out, male and female medical wards. Notice the hallway here is outside. That's unusual. It's pleasant because if you need a quick fresh air break, you just walk out. But the climate is so temperate that this is fine, being outside like that. No snow. And here's just an average medical scene during morning rounds. This fellow's a physician, and so is this guy, and this is obviously a patient. And the patient is being examined. But the reason I put this slide up is that things are not totally wonderful, despite all the diamonds. And you can see that this poor fella, even though he's got a mattress, is on the floor. So things are not exactly great, but much better than other places in the developing world. That is, there are beds, and if there's no bed, there are mattresses. People have pajamas. People have bed sheets. People are fed. They get 2 very nice meals every day. There are other hospitals in the developing world where there are no bed sheets or pajamas. And if you don't have a family to bring you lunch, you don't eat lunch, or any meal for that matter. So Botswana is way ahead in that regard. And here's just some happy doctors. I think they were happy because this was my last day, and I was leaving. They were glad to get rid of me. But this fellow's from the Congo, and he's from Botswana. And he's a student from the University of Pennsylvania, having the opportunity to work with HIV patients at Princess Marina. And you know who this is. So, what happened every morning is at 7:30, which is nice and early, but everybody was right on time, is that all the patients who were admitted in the previous 24 hours were presented. So the doctors who were going to take over would know who they are and a little bit about them. And also we discussed a little bit about each case. And here I am talking about one of the cases. Brand new building, totally air conditioned. The windows don't open. And it turns out when I came in closer to see what it was, it's the health ministry. The minister